Okay, so in this video, I'm going to be talking about inspection, followed by palpation, followed by active range of motion, followed by passive range of motion, and then in-field assessment, and then lastly, a resistive range of motion of his ankle joint. Okay, so first, I'm going to start off with inspection. For inspection, I'm looking at both his feet. I'm looking at the color of it, making sure, there's no gangrene, there's nothing, going perhaps black or red or pale or blue. I'm checking if there's inflammation, any cysts, any scabs, any the back of his sole, which is the healthiness of it. I'm checking his nails, making sure they're healthy, maybe looking for hemorrhage, perhaps from an injury, and that's it for inspection. Then I'm going to be moving on into palpation. The first one, start with temperature check, doing that bilaterally, making sure it's symmetrical, making sure it's an average temperature. If something is really cool, it could be because there's not enough blood flow to the area, perhaps an arterial problem. If something is really warm and there's edema, it could be some inflammation and a venous problem. Alright, then I'm going to move on into palpation. Sure, let me know if you feel any discomfort or any pain. Okay, so start off with superficial palpation, palpating the bony anatomy, his calcaneus, lateral medial malleolus, cuneiform, talus, navicular, his metatarsals, phalanges, tarsal bones, checking the sole, also checking those intrinsic muscles of the foot, in between each toe, and then doing that bilaterally. Okay. After palpation, I'm going to go ahead and move into active range of motion. So getting my goniometer. Alright, so as far as the goniometer, how to place it, for the sake of this video, I'm only going to be doing his left leg measurements for active range of motion. However, it's important to remember that you want to do this bilaterally and you want to start in the non-involved side because that's going to give you your normal values. And then you want to compare that to the injured or injured leg and see the differences. So, but for the sake of this video, I'm just only doing it in the left foot. So do you have any problems with your left ankle at all? No. Or your right ankle? No. So he has no problems, so I'm just going to go ahead and do it in this way. So for the goniometer, you want to place the center point in the lateral malleolus. You want to place the stationary arm going across his leg, his pretty much fibular bone. So center point going at the center of the lateral malleolus. I'm going to sit down here so that it's better to see. And then can you go ahead and lift your foot a little bit? We want to make sure it's at 90 degrees. That's going to be our start position. The moving arm is going to go into his fifth toe. So can you move it up a little bit more? Perfect. So that's going to be the start position. So now, sure, what I want you to do is go ahead and flex your foot. That means imagine you were driving and pressing on the pedal. There you go. Can you go back to neutral and try not to move your knee, just your foot? Do it. Okay. So he has 60 degrees. Since the start position was 90, we subtract that, so he has 30 degrees of plantar flexion. Come back to 90, a little more. There you go. And then move it all the way back. Is that it? Okay, so he only has 5 degrees of dorsiflexion. It's important to remember the normal values. The normal values for plantar flexion is 20 degrees, and then the normal values for dorsiflexion, normal values for dorsiflexion is 20 degrees, plantar flexion is 50 degrees. So he's very limited in dorsiflexion. There might be something going on. Perhaps he could benefit from an adjustment. And then after dorsi and plantar flexion, we're going to do inversion and eversion. So how I'm going to do this one is I'm going to place the center point at the center of the talus, talar bone, which is right here, and then I'm gonna follow the moving arm in going into his second toe. Okay, so all right. So starting position is going to be at 180 degrees, or 0 degrees. Okay, and that's pretty good. Can you go ahead and, without picking up your knee or leg, just move this foot as far to the right. Come back to neutral though, and move it whenever I tell you. Wait, go ahead and move it. All right. So we take that measurement. He has 40 degrees, and that's inversion. Normal for inversion is anywhere from 45 to 60 degrees. And then come back to neutral. That's good right there, and then move it out. No, the opposite way. There you go. And he has a little bit more. He has 55 degrees. And for eversion, normal should be 15 to 30 degrees. Sir, did any of those movements bother you?
No.
Since none of those movements bothered him, we're going to go ahead into passive range of motion. However, if he said yes, then we would not do passive for that certain movement that he was hurting. So I'm going to first do dorsiflexion. Does that bother you?
No.
Alright, so I'm going to push it to end feel. It feels like tissue stretch. Then I'm going to do plantar flexion. Does that bother you?
No.
Push it to end feel. It feels like a tissue stretch. Inversion. I'm going to move it like that. Does that bother you?
No.
And then end feel is tissue stretch. And then eversion. Does that bother you?
No.
That feels like tissue stretch. For resistive range of motion, what I'm going to ask you to do now, sir, is you're going to do certain movements, and then you're going to try to resist. So we're going to start with plantar flexion. Try to push my hand down. And then, yeah. Does that bother you?
No.
Alright, good. Now try to push it up. Does that bother you?
No.
Wait, try to push it to the side. Does that bother you?
No.
And then to the other side. Does that bother you?
No.
Alright, so he's good. That was inspection, palpation, active, passive, and resistive range of motion. Okay, so this is called the Thompson's test, aka Simmons test. And what I'm going to be doing is, sir, do you have any pain in either of your calf or ankle?
No.
Alright, so you always want to start in the non-involved side first, but for the sake of this one, I'm going to start with his left. So go ahead and relax your leg, and then I'm going to be pressing onto his calf, and then I'm observing for that plantar flexion. Then I'm going to repeat on the other side. Relax the leg, and observing for that plantar flexion. If I don't see any plantar flexion, that would be indicative of a Achilles tendon rupture. Alright, so I'm going to be doing the lateral stability test, also known as the inversion test. And then I'm going to be doing the medial stability test, also known as the eversion test. So for lateral stability test, I'm just going to grab the foot, sir. Do you have any pain in either side?
No.
No? So I'm going to, this is lateral stability. I'm going to grab the foot and push it into inversion. Any pain with that?
No.
I'm going to repeat that with the other leg. Any pain with that?
No.
Okay, so that is lateral stability. Excessive gapping in the joint, so I'm feeling in the lateral malleolus. Excessive gapping in that joint is a positive finding for indicative of the anterior talofibular ligament sprain, or it could also be a calcaneofibular ligament strain. Now, as for the medial stability test or eversion test, I'm just going to do the same, but now driving into eversion. Any pain with that?
No.
Doing the same with the opposite foot. Pain with that?
No.
So I'm feeling the medial joint line, medial malleolus. If I feel for excessive gapping, it's indicative for deltoid ligament sprain. Alright, so this is called the drawer's foot sign. The drawer's foot sign. Sir, do you have any pain in either ankle?
No.
No, so what I'm going to be doing is I'm going to stabilize here on top of that ankle, and then I'm going to push, pull the ankle up. That's anterior. and then I'm going to do the same on the opposite leg. Did you have any pain with either one of those? No. No? Okay, so now I'm going to push down or posteriorly, anterior to posterior. Any pain with that?
No.
I'm going to do the same. Pain with that?
No.
Alright, so what I'm feeling is for excessive gapping, laxity in his joint. If he has excessive gapping while pulling, that's indicative of a anterior talofibular ligament sprain. If he has excessive gapping while pushing down posteriorly, it's a posterior talofibular sprain. Alright, so this is called the Tinel sign of the foot. Sir, do you have any pain, numbness, or tingling in either foot or ankle or leg?
No.
No? So what I'm going to be doing is I'm going to be tapping on your foot. Let me know if you feel any of that numbness, tingling, pins and needle sensations, okay? So I'm going to find the medial malleolus, come a little posterior to it, and then I'm going to be tapping on that, trying to find the posterior tibial nerve, and trying to tap on it. Did you feel any tingling sensations? No? Alright, I'm going to repeat that on the other side. Anything?
No.
So if he had felt any numbness, tingling, pins and needle sensation on that posterior tibial nerve distribution, it would be a positive test, and it's indicative for a, it's called the foot tunnel sign, or also known as indicative for a tarsal tunnel syndrome. Alright, so this is called the Morton's test. It's for Morton's neuroma. Sir, do you have any pain in either foot? Numbness, tingling?
No.
No? Okay, so what I'm going to be doing is I'm going to compress the forefoot. So I'm going to grab it and press. Does that cause you any pain?
No.
No? What about here?
No.
Alright, so pain, especially if he feels any paresthesia, would be positive for a Morton's neuroma.